Thank you and welcome to the show this morning. The topic this morning is heart disease and hypertension. And we're fortunate to have with us Dr. JThomas, professor of medicine at Meharry Medical College, and his daughter, JThomas, who is a chief investigator with one of the projects that Dr. Thomas is involved in. And let me welcome both of you to the show this morning, Dr. Thomas.
Well, good morning. Thank you.
Very good. Dr. Thomas, let's have you give us some information about how you became involved in the study of hypertension and heart disease, and some of the earlier biographical information that you'd like to give us concerning your early career and how you came to Meharry Medical College.
Well, that's a long story, and I imagine that if you would think about people who were supposed to be physicians, as far as financial point is concerned, I guess I stood a very poor chance of being a physician because I came from a very poor family as far as money was concerned. But I had people who took particular interest in me, in particular a family physician who probably was my role model. And my church played a great part. I belong to the AME Church. And as you know, the AME Church was fundamental in establishing educational programs for black. So when I finished high school, I had a small scholarship to go to Morris-Brown College. And so that enabled me to get a college education. And from Morris-Brown College, I came to Meharry and did my medical training. After that, I did a year of residency, 1 or 2 years of residency in medicine. And because of the financial status that I was in, I had to go back and practice medicine. So I went back to Rome, Georgia, and practiced general medicine for a while. But my interest was still in doing some research. And I saw so many people that had cardiovascular disease, a disease of the heart, and we didn't know much about it then. So I decided to go back. After 3 years of practice of general medicine in Rome, I went back to Meharry and did further training in cardiology. And I was supported by the National Heart Institutes. I was one of the first trainees of the National Heart Institutes in cardiovascular disease at Meharry.
Very good. And of course, Mr. Thomas, you've worked with your father in one of the major projects that he's now involved in. Why don't you give us some information about how you became involved with his project?
Well, I graduated Transylvania College University now in 1971. Initially, I knew that I wanted to go into international health. I was going to be an ambassador in some respect. I was accepted by AID to do a training program. It's the Agency of International Development, and just as I was to go into the program, it was phased out. I needed a job for the summer. I needed something to do, so I started working at Meharry in Dr. Thomas's program. At that time, it was a student hypertension project. I enjoyed it. I liked it. I was goal-oriented, so I enjoyed working in research, and I've been there ever since. I received my master's from Meharry Medical College, Master's of Science in Public Health in 1979, and I've been involved ever since.
Very good. And so we've got a father and daughter team here, Dr. Thomas, dealing with cardiovascular diseases and some of the other things related and associated with that. Let's talk about that this morning. Now, we do understand that the last Sunday in this month, Meharry has a forum planned to deal with this as a topic, heart disease and hypertension. Let's talk about that forum for a minute and give our audience some idea as to what it's all about, and then we'll talk about some of the problems that it will try to deal with at that time.
Well, the forums that are being sponsored by Meharry is a method of interacting with the community and making the community aware of diseases that affect them, particularly as far as prevention and control of these diseases. And two of the major diseases in the community, as far as blacks are concerned, is hypertension and atherosclerosis, the condition that causes heart attacks. And so we are happy to be able to interact with the community at this time, and we'll talk during that forum. We will talk about how hypertension and atherosclerosis, heart attacks affect the problem, the black community, and the problem that exists as far as control and therapy of these diseases in the black community.
Very good. Ms. Thomas, let's look at some of the activities associated with the forum.
Right. We have, it's scheduled, as you say, the last Saturday in every month, and it's been going on for the past 6 months or so, and all topics have been discovered, from cancer to weight loss, all types of topics that concern blacks predominantly. We give free testing of blood pressure and cholesterol screening. It starts at 11 o'clock, and it's held in the LRC building, which is the library building. It's on the bottom floor. After the topics are discussed, we have Dr. Thomas will be the major presenter. It's a question and answer period. If you have any questions whatsoever, the audience is invited to ask them. And afterwards, it's followed with a heart-healthy lunch and consultation, if you need any, on any abnormal findings that might be detected at that particular time. And it's been very well received so far by the community. We've even had a careers day that was sponsored for the kids, whereas all health professionals, or just professionals at Meharry Medical College, gave presentations as to their career patterns and tracks and whatnot.
Very good. Dr. Thomas, let's look